As a reproductive endocrinology and infertility specialist, I really get to help women in so many different ways. From the endocrinology aspect, there's so many women who come in saying, my hormones are all over the place. I'm not feeling my best. I'm not doing well, and really getting to work them up and getting things corrected, balanced, feeling their best is one of my biggest goals. I also love getting the opportunity to help them build their families. So whether that's with minimally invasive techniques or something like IVF, and developing embryos in the lab and being able to help them in that way, like every baby just feels like such a miracle, and it's really special to get to be a part of. I had this patient that was actually really unique that I got to interact with her in multiple times in her life. The first one being when she actually found out that she had a mid-trimester loss and helping her manage that process. And then got to see her full circle for infertility care later, and took her through like ovulation induction and IUIs, and she ended up becoming pregnant and having her first son. So that was just really exciting to see her from like a really hard time to this like huge victory. It was really special. When somebody comes in anxious, which is pretty much every single time when you're at the point of going through IVF, I think it's really important to address it from the beginning, to address underlying root issues. Is there strain in the relationship going through infertility? It's really difficult. Are we connecting emotionally? Are we doing everything that we can to minimize unknowns? Like, are we explaining everything very well so that they don't feel lost at all in the process? And I really like to educate my patients so that they become like mini IVF doctors themselves and just feel really confident going through the process. I just want people to be able to build the families that they want. I mean, that's really our ultimate goal, is showing women how much we care, getting them the care that they need to reach their goals of building their families. So that's really why I'm passionate about infertility.